Hi, everybody. My name is Ryan Benavente,
And I'm Nikki Boardman.
and we were both fellows this past few months at Access Afya. Access Afya is a social enterprise based in Nairobi, Kenya, whose mission is to deliver accessible and affordable healthcare to those in most need of it in the urban populace of Nairobi in general. And so I'd like to start this discussion with a really simple question. In your opinion, Nikki, given the work that we've done in Kenya for the past few months, what do you think are some of the most pressing issues in healthcare that are often unseen or untapped into?
I think one issue that really came to the forefront of both of our minds in the context of this fellowship and what our project dealt with is the disconnect that can be present between business and marketing strategies and delivering healthcare. So I think with both of us being pre-health students, we've always focused on healthcare in the sense of medicine, treatment, patient interactions between just the physician and the patient, and not so much like looking at healthcare holistically and as a multifaceted interdisciplinary field. So yeah, during our work this summer, we kind of were really thrust into marketing strategies for healthcare organizations and how that's different a lot of times from other businesses, just because of like the patient physician dynamic and with patients being a vulnerable population. And so how you kind of have to maneuver around that when marketing, but also doing it in a way that's effective and getting people to seek healthcare to improve health outcomes. So yeah, what about you, Ryan? What do you think?
No, definitely. I completely agree with a lot of that, and I think there's a lot of sensitive issues, especially around patients trying to persuade patients to seek certain services that might be very valuable. I think, at least here in the West, we think that these problems can be solved by throwing money at it, or with new technology and new science. But what's interesting is that, despite having a lot of access to effective medication, you can't really expect it to, create results in a population if you can't convince people to buy it, or you can't promote it in a way where people find it valuable for their lives and their health. And so when it comes to health, I think we think a lot of the times it's technology and science that are really the main drivers to good health. But I think a lot of it is that human connection, and forming that through a variety of means, whether that be, through the economy, or through the creation of sustainable networks, or or through marketing. I think those are all very valuable. Um, and that kind of brings me to something that I know we're both very interested in. But in your experience, how do you think that entrepreneurship, what role does it play in kind of healthcare and the delivery of it in the global South?
I think that social enterprises as healthcare organizations in the global south is something that we should focus on in the West instead of other alternatives to delivering healthcare in the global south, like medical mission trips and things like that. I think that social entrepreneurship in the field of healthcare has just so much potential in terms of making it sustainable, because even in the West we're already having issues with that of a shortage of physicians and nurses and healthcare resources. If we're experiencing that here, then obviously those problems are exacerbated in the global south. So yeah, so making resources sustainable, and also kind of preventing that notion of white saviorism that can come a lot of the times with um, medical mission trips or um, organizations that focus on just funneling
Mhm.
money instead of actually finding a solution that's rooted within the community and supports community values and uplifts community voices, and people within those communities who maybe have some untapped passion for healthcare, and have a dream of, working in healthcare, and providing jobs for them, and letting them kind of live out their dreams, if that's something they're interested in. So I think it's like it's overall just a sustainable solution, in terms of resource, in terms of manpower. Um, and yeah, what do you think, Ryan?
No, 100% completely agree. I think that one thing that we've both learned, and I think you can resonate with this as well, is that often we will never learn more about a community than the people who've lived in the community, who've raised children in the community, who have invested interest in that community. We can never know as much as they do. We can, perhaps provide an alternative perspective, but when it comes to solving their own problems, I think that, this notion that people from the West are required to come in there and kind of save people. I think that's a very false notion, and it comes from a lot of pride. And I think that instead taking an approach where we we empower their own voices to be heard, voices that they have, um, and we give them, the tools, the knowledge, and the training that they need to, teach themselves how to fish, as opposed to providing fish for them. Like you said, it's quite the sustainable trajectory in the long run, and social entrepreneurship is just one of those paths that allows that to be possible. Whereas and not of course nonprofits have their role, but solely relying on nonprofits, it doesn't create that type of social impact. Um, yeah. Um, yeah, go for it.
I was just gonna ask you, Ryan, as someone who is pre-med, looking, planning now, your future in medicine,
Mm.
how has a fellowship in social entrepreneurship helped prepare you for a career in medicine?
That's a great question. And personally, my own journey throughout this fellowship, I've gained a lot of insight into myself and the field itself and kind of what I want to do. I realized that my goals when it comes to helping my own community in Honolulu, Hawaii, and the community of America, and the issue of accessibility that goes on in our country. This isn't something that can be simply solved with being a better doctor or knowing more about disease. And those are important things. But I think that there are other things that need to be taken into account: economics, business, psychology of people, and why people make certain decisions, and the government forces that kind of work to influence people, and all sorts of these outside things that, what I've really taken away from that is that the discipline of medicine is very, very narrow and very focused on one thing in particular. I mean, that's something that I'm passionate about and I hope to pursue. But I always never want to get stuck in a fixed mindset, and I want to continue to explore different ways um, to inspire people to take care of themselves and to, inspire good health. Because I think there's a lot of other factors that determine whether or not people live healthy, and so on and so forth. What type of career insights have you taken, Nikki, and how do you kind of see them affecting, your awesome path into the future wherever you go?
Well, thanks, Ryan. I think this fellowship really kind of ignited passion in me in terms of, pursuing a career in healthcare. It really made me see the impact that you can have on people's lives, with a career in medicine. I think before I was really just interested in pursuing, a medical career just because science and innovation has always been fascinating to me. But really being exposed to like the human aspect, of a career like this, really has made me passionate about it, and makes me excited for the kind of work that I'm capable of doing and the lives that you can reach by doing that and improve. And yeah, it just makes me excited. And it makes all the hard work seem like it's worth it when you see, the impact that you can have. And I think, in terms of the fellowship, it really just solidified the importance of ethics in healthcare for me. Um, I think it really like showed all the different ethical principles that we learn, and how it applies in practice and in the real world, like utility, doing the most amount of good with the resources available. In the global south, this is by far, the most true and prominent ethical principle I think that can apply, because it is so you're working in such resource constrained areas. So, like, how do we innovate systems or technologies to produce the most amount of good with the resources available? And also, another one would be prioritizing those with the most need. I think that healthcare, this should always be, the pinnacle of a mission in healthcare, or an organization, because I think it's medicine's duty to do that. Um, and yeah.
Cool. Any final closing remarks?
I think that people should start more healthcare centered social enterprises. I think they're amazing. I think it's an untapped market, or I think it's starting to, pick up speed. But I think that, at least, maybe I'm biased, but out of all the different fields that you can enter into in social entrepreneurship, I think that medicine is super exciting, and arguably has the most impact on people's lives. So
I'd agree. I completely share that sentiment. I think if you are passionate about health and passionate about medicine, this fellowship is a really good entry into exploring different ways into how other factors influence health, and kind of broadening perspectives and the horizons of what is possible in medicine. And I think coming from a background of sciences where we're constrained to thinking that there's one solution for everything, this fellowship's been a breath of fresh air in many, many aspects.
all right, thank you.
Thank you.